Good day everyone, I'm Hannah Kate Sinavida from BSN 1Y0-24A, and today I'm going to perform breast bath for an adult patient. So the purpose of this is to remove transient microorganisms, body secretions and excretions, and dead skin cells, and also to stimulate circulation to the skin to promote a sense of well-being and to produce relaxation and comfort. And lastly is to prevent and eliminate unpleasant body odor to the patient who are unable to do it themselves. So for the assessment, we must check the physical, emotional, and skill factor or condition of the patient, as if there is could have been bed sores, and if the patient is emotionally unstable, we must wait or make them we have to make them calm down so that the process of the bed bath won't have any trouble. And lastly is we have to assess if there is wounds in their skin so that we could be careful and take care of that part that has wounds to avoid discomfort to the patient. Now for our planning, we have our equipment, basin with warm water, linens such as bath blanket, bath towels, and washcloths. For the client, we have fresh clothes or gown to change, personal hygiene articles such as comb, and then we have soap. And for microorganisms, cautions, we have clean gloves and mask. And lastly, we have the bag or the hamper for soiled linens. For our implementation, we have to prepare and determine the purpose and type of path, any movement or positioning precautions, and the client's comfort level with being bathed, and the self-care ability of the client and the care the client may be receiving, and the necessary bath equipment. To perform this is first we have to introduce ourselves and verify the client's identity. We have to explain the procedure of the bath, and we also have to discuss with the patient of what are their preferences during the bath. We also have to observe the appropriate infection prevention procedures. We also have to provide for the client privacy and prepare the client and the environment, and invite the family member or significant other to participate. So next is we have to offer the client a bedpan or urinal to use the toilet or commode, so that when we proceed with the bath, we won't have any trouble once if the patient wants to urinate. So next is we have to encourage the client to perform as much as personal self-care as possible. So for the best bath, we must prepare the bed and position the client while observing safety.
So first is we have to place the bath blanket over the top sheet and ask the client to grasp and hold and remove the top sheet. So next is we will remove the client's gown while keeping the client covered and place the gown in linen hamper. So next is we have to make a bath mitt with washcloth, and the first thing that we're going to wash is the face. So first is I'll place the towel under the client's head and wash the client's eye with water only and dry them well. Use a separate corner of the washcloths for each eye. Wipe from the inner to the outer contours. Ask whether the client wants soap used on the face. Wash, rinse, and dry the face, ears, and neck, and remove the towel from under the client's head. Next is we're going to wash the arms and hands. We're going to place the towel lengthwise and wash, rinse, and dry the arm by elevating the client's arm and supporting the client's wrist and elbow using long firm strokes. Apply deodorant or powder if desired, and a special caution needed. So place a towel on bed and put a wash bin. Place the client's hands in the basin for soaking and assist the client as needed to wash, rinse, and dry the hands, paying particular attention to the spaces between the fingers. Next is we'll wash the chest and abdomen. We will have to place the bath towel lengthwise over the chest and fold bath blanket down to the client's pubic area. We will have to lift towel off the chest and bath chest and abdomen. Give special attention to the skin folds, wrist, and dry well. Replace the bath blanket when the areas have dried. Next is we will have to wash the legs and feet. To wash the legs and feet, we will have to expose the leg farthest, being careful to keep the perineum covered. Lift the leg and place the bath towel lengthwise under the leg. Wash, rinse, and dry the leg. Reverse the coverings and repeat for the other leg. Next is wash the feet by placing them in the basin of water. Dry each foot and pay particular attention to the spaces between the toes. Obtain fresh, warm bath water now or when necessary. Lower the bed and raise the side rails when refilling the basin. Next is we're going to wash the back and then the perineum. Assess the client into a prone or sideline position, and then place the bath towel lengthwise alongside the back and buttocks while keeping client covered. Wash and dry the client's back, paying attention to the gluteal folds. Next is remove and discard gloves if used. Perform a back massage now or after completion of the bath and assist the client to the supine position and determine whether the client can wash the perineal area independently. If the client cannot do so, drape the client and wash the area. During the bath, assess each area of the skin carefully. Assist the client with grooming aids such as powder, lotion, deodorant, and use powder sparingly. Help the client put on a clean gown and pajamas, and assist the client to care for hair, mouth, nails, and some people prefer or need mouth care prior to their bath. And lastly is we have to document the procedure.